Premier, I've listened, closely to your responses in Parliament to the questions we've asked, and I'm listening to what you're saying now and Mr Webster, and I suppose what I hear is you never address the reality that on the 23rd of June, the majority of services that are provided to people, life-saving services to many, will not be available anywhere else in the public health system. They will not be. And people who are patients and people who are psychiatrists working there now, they want you to say those words. They want you to be honest about the fact that we're in a desperate situation and you're there with them and you're open to every option. Why aren't you being honest about the fact that there will not be TMS available for months or years because you can't whistle up the places? Why aren't you being honest to the two psychiatrists who between them have got 38 years of experience and maybe 3,000 patients who have told us publicly that they're closing their books because there is nowhere else for them to deliver their services? Can you just be honest and say, yes, this is a terrible situation and we don't have the solutions. We want to hear your ideas.
Well, we're working on the solutions, Dr. Woodruff. I have been very honest around the real challenges that this situation has presented. And I've spoken many times about it and very concerned. We are extremely disappointed in Healthscope, but discussions are underway about establishing the TMS chairs with the two private providers, including the Hobart Clinic, as I think Dale mentioned. In the longer term, TMS services are also being considered within the North and the Northwest mental health precincts. ECT is a medical procedure used to treat psychiatric conditions and involves the administration of a carefully controlled electric current to the brain. And of course, ECT aims to reduce the severity of depressive and psychotic symptoms. It's available within the public healthcare system in Tasmania, ECT, delivered in the Tasmanian Health Service and via the Hobart Day surgery with the patients under the care of the Hobart Clinic, and I'm advised that the capacity of these services, as an example, can be expanded to match any increase in demand. Well, the Hobart Clinic, I'm advised, are in discussions with private psychiatrists and the Department of Health about the transition of inpatient and day programs from St Helens Private Hospital to their centres in the Hobart CBD and Rokeby. We acknowledge also that some of the patients who would normally receive inpatient treatment and care at St Helens will not necessarily have the level of acuity typically seen in public inpatient services, as St Helens is not a gazetted facility. Their needs and preferences regarding their treatment and the care may be provided, or even better provided, for within alternative subacute or community-based environments such as the newly opened 12-bed Peacock Centre, the Hobart Clinic, the Mental Health Hospital in the Home, Detox at Home, or other settings. Of course, in addition to these options, a further 27 beds will come online with the completion of the new St John's Park facility in Newtown in 2025, and including
please give us the dignity of not parroting the things that you've already said. We've only got another 35 minutes left to ask these questions. We've heard all this before. You know yourself there's a gap between the 23rd of June 2023 and 2025. Dr. John Saul, the head of the AMA, called out the sort of rubbery numbers that you're using on St John's Park, and he said when you look at the 2019 master plan, we were looking at 85 beds being promised for the repat development, but when you look at this proposed St John's facility, all that's mentioned so far is an additional 15 beds and 12 beds for eating disorders, and you've been announcing that every year, I think, since I've been an MP. So what he says is we've lost 31 beds at St Helens, and sadly, the numbers don't add up. So when Mr Webster says these cohort of patients are not necessarily those that would come to a public health hospital. I'm telling you, they may well be because of the desperation of not having services on the 23rd of June.
So,
What are you going to do about it? Can you, I would love to hear you really reaching into the suggestions that have been offered, like from Dr. Tim Lane about getting medi-hotels for some of those mothers who are receiving treatment at the moment. He says it very clearly, they do not need a paediatric ward in a hospital. Have you investigated that option?
Well, we're working around a range of options. We understand the seriousness of the situation, Dr. Woodruff. It is a huge challenge, and we want as much of care to continue as is practicably possible. Now, you mentioned Dr. Saul, who I've got a lot of respect for, and you mentioned some bed numbers and what he thought may well be the situation. But, Mr. Webster, could you like to update the committee with respect to that?
It's a huge loss of beds.
Minister, there is no loss of beds with the move from Repat to St John's Park. Dr. Saul has mixed up different buildings and different options. So we were always moving Roy Fagan to Repat, now we're moving it to St John's Park, same number of beds. So the Repat was going to have the mental health inpatient unit from the Royal. Those same number of beds will move out to St John's Park. So the 15 or mental health beds and eating disorders bed are in addition to those that are in the master plan and were planned originally for Repat, now planned for St John's Park. So they're not, we haven't reduced from 85 to 15. We have in fact moved them from the Repat site to the St John's Park site.
They're negative 31 beds that are no longer at St Helens, though.